Hello everyone and welcome to my channel. I'm Dr. James Randolph, physical therapist, and in this video I'm talking about vertigo, and more specifically positional vertigo. I'm going to talk about one of the more common underlying causes for positional vertigo, how it can present, and techniques that we utilize in physical therapy to help relieve this condition. I'll also review a self-management technique that people can perform themselves right at home. Now, positional vertigo is also known as BPPV, which stands for benign paroxysmal positional vertigo. This is typically characterized by dizziness or a spinning sensation, like the room is spinning or there's spinning going on inside the head. And these symptoms are typically brought on with certain movements or positional changes. A common position change which can aggravate this vertigo is when someone goes to lay down. This changing of position can make someone very dizzy. In fact, many individuals with positional vertigo often try to avoid lying down the best they can so they don't bring on these symptoms, which can vary from mild to severely intense. Even simply bending forward or lifting the head up can bring on symptoms of vertigo. Let's talk about one common cause for this. Inside the inner ear, we have semicircular canals, or tubes, which are filled with fluid, and extending into this fluid are microscopic hair-like structures called cilia. When we move our head, the fluid in the inner ear moves, which stimulates these hair-like structures, and this mechanical movement is converted into electrical impulses, which we are then able to perceive as motion. That's normal. Now there are also tiny particles in the inner ear that can break loose and float around in that fluid. And when this happens, that debris can stimulate those cilia when they shouldn't be stimulated, giving a sensation of motion. So quite simply, with positional vertigo, there's microscopic debris floating around in the fluid in the inner ear, stimulating nerves when they shouldn't be stimulated. The good news is that there are techniques we can use in physical therapy to identify and relieve symptoms of positional vertigo. One technique to identify this is the Pike maneuver. We start with the individual in a sitting position with the head turned toward the ear being tested. We then lay the individual down with the head dropping off the table while keeping the head turned to the side. Here we're looking for specific symptom provocation, which may take several seconds to develop and indicate a positive test. We can also go on to test the opposite ear as well if indicated. Once we've established that what an individual is experiencing is consistent with positional vertigo, we can move forward with specific treatment. One such option is the Eppley Maneuver. To begin the Eppley Maneuver, the patient starts in a sitting up position with the head turned 45 degrees towards the ear being treated. In this video demonstration, we're treating the left ear. Next, while keeping the patient's head turned, the examiner assists the patient lay down quickly with head dropping off the table approximately 20 degrees while still maintaining that head rotation to the left. This position is typically held until symptoms of dizziness subside. This should range between 20 to 60 seconds. Once the symptoms subside, the head is then quickly turned to the right side 45 degrees. Again, this position is held until symptoms of dizziness subside. Next, while keeping the head turned towards the right, the patient turns onto the right side so as to end up with the head turned 45 degrees towards the floor. This position is again held until any symptoms subside, but shouldn't last beyond 60 seconds. The final step is to sit up on the right side, keeping the head tilted down towards the chest and holding this 20 to 60 seconds. When performing this technique alone, the individual may choose to position a pillow under their shoulders so as to not have to drop their head over the edge of the bed. If performing this maneuver for the right ear, the individual would begin step 1 of the process with the head turned 45 degrees to the right, then turning the head to the left, then turning to lay on their left side while keeping the head turned towards the left, and finally returning to sitting on the left side with the head held down towards the chest. Now, an individual may need to seek consultation from a healthcare provider before initiating this maneuver to ensure this technique is appropriate for their condition. Also, identifying which ears to be treated can be tricky as a condition may be localized to the left ear, the right ear, or possibly both. Additionally, after completing the Eppley maneuver, which may take 1, 2, or even 3 trials, individuals are encouraged to avoid any positions which may provoke symptoms for at least 24 hours. This may include bending forward, lying flat, or looking up with the head. Individuals are typically encouraged to sleep in an inclined position of 45 degrees for the first night. And finally, if symptoms persist, be sure to follow up with your healthcare provider as there may be other underlying causes to your vertigo. I hope you found this video informative. Be sure to hit that subscribe button to see more of my videos on physical therapy, health, and wellness, and go ahead and leave a comment in that comment section to let me know what you think of this video. Thank you for watching.